On today's Two on Your Side Town Hall, legalizing marijuana. It has not been a quick process, but there is some progress to tell you about. We'll look at what's behind the delays and the impact of all that. Plus, more attention coming to long-haul COVID. We'll talk with a doctor about the impact of a new focus on the condition and why he calls it a black box. And the return of Fall Fest. We'll hear how things will be a little bit different down in Ellicottville as the event has a big comeback. A lot of people looking forward to that. We're glad you're here with us, everybody. I'm Michael Wooten. Kate has the night off, and we're going to start today's town hall with recreational marijuana. The state agency that is in charge of regulating cannabis here in New York State finally met yesterday for the first time. And that's led to a lot of questions about what happens next. That first public meeting of the state's Cannabis Control Board happened more than 6 months after the previous governor signed into law the bill that legalized marijuana, so it's been a while. Keep in mind, though, some members of that board weren't even appointed until late this summer. Advocates are now pushing the state to try to make up some ground and cover up for lost time, which has already delayed some aspects of the law, like a provision that lets medical marijuana cardholders grow plants. It was supposed to happen 6 months after the law went into effect. So joining us live right now to discuss is Tom Hughes, co-team leader of the cannabis practice team at Lippis Mathias Law Firm here in Western New York. Tom, great to have you back on. Thanks for your time.
Appreciate it, Michael. Good to be back with you.
All right, so let's just check in kind of on where things stand right now since we had that meeting yesterday. We last spoke about this in July, and at that point there was almost no progress since they actually signed the bill. What is different now from then, and what is actually happening?
Sure, appreciate it. And you actually touched on a lot of these things in the lead up here. What is different is that we've got appointments now. We've filled the vacancies that existed from the time the legislation passed up until September 1st. And I think we've seen that Governor Hochul, since she's kind of taken the reins, has really prioritized marijuana and the implementation of the MRTA, which is obviously very encouraging for people such as myself and the people who are awaiting these regulations. As you recall, she's convened a special legislative session and appointed the 5 members of the Cannabis Control Board. She appointed Chris Alexander as the executive director of the Office of Cannabis Management. And as you mentioned previously, the CCB finally met yesterday for the first time. So we're starting to see the wheels turning here.
It's interesting when you look at what was overwhelming support for legalization among lawmakers, yet they couldn't quite agree on how they should actually do this. That has led in large measure to the delays in just passing the law, and then now we have the delays in implementation. I wonder about, the fact that we now have these people appointed. We now actually have the first meeting. Is that real progress, you think?
It is. It's a necessary step to get where we needed to go. I think from the time that the legislation was passed, we knew that it was not going to be tomorrow that these regulations and the licensure applications and grants were going to be implemented. We knew that there was a timeline attached to that, but what these appointments did is they started that timeline. And as you can see from what occurred at the board meeting yesterday was the authorization for appointments to be made and employees to be hired. And I think, from those of us who have spent any time in corporate America, it's probably not going to be the board members who are drafting the legislation themselves. So what that did is that really it gets the wheels turning, and there's a lot of, light on this right now. There's a lot of attention on it. So I think that they'll be moving rather quickly, if I had to guess.
And look, not everyone watching right now is even, supportive of legalization for recreational purposes, but that is, of course, now behind us. And so I think people are very interested, no matter where they stand on how this is going to play out. So now that the board is actually meeting, do you think there's an opportunity here that they can pick up steam and maybe make up for some of the delays that there were before? And what would be a realistic time frame kind of going forward?
Sure. And I'll just focus quickly on what they've done. They've by making these appointments and appointing the chief equity officer who will kind of govern a lot of the social equity components of this legislation and regulations. They did do some things yesterday. Medical patients can now buy actual marijuana flower at dispensaries. They did acknowledge the missed deadline that you mentioned with regards to home growing and have committed to expediting that process. As far as the actual licensure regulations and accepting licenses and granting licenses, I mean, optimistically, we could say the end of 2022 could still be a realistic deadline. I think we'll have a lot more information and a lot of kind of steps in the process towards that end, and productive ones in the near future, we hope. But the timeline is still about what we expected. I'd be surprised if we actually see licenses granted before the end of 2022, if I had to, guess.
Yeah, I've always thought it was so strange that it is legal right now to consume cannabis, but it is illegal to purchase it and it is illegal to grow it. So it's kind of like there's a disconnect there, but we'll, see, you mentioned within 14 months the system should be up and going. Finally, and we're almost out of time, but I wonder if you can speak to this debate that is now happening in Congress as well. I know that some people, you may be included, have worried that if Washington, D.C. moves forward with some type of legalization, that it actually could kind of get in the way of what New York is trying to do. But there are conversations, on Capitol Hill about doing some stuff federally.
Sure, and I'll just mention, because probably the most important thing, the MORE Act in the House, we actually passed out of the House Judiciary Committee on October 1st. So that's a huge step. I think there's still some obstruction out there for that, but I think the bill now has 76 co-sponsors in the House. The Senate is a little bit more disjointed. They're trying to balance the legalization of marijuana banking and the kind of the judicial reform and full legalization that some of the more hardy proponents in the Senate want to see. But I do not think it will be a negative thing for New York at all. I think lifting the ban and descheduling marijuana on a federal level is only going to provide more certainty and more benefits from a tax perspective and from a kind of an operational perspective to state operators such as the ones in New York that we're going to see licensed hopefully in the near future. Yeah, having access to better banking services and that sort of thing would be very big. Tom Hughes is the co-leader of the Lippis Mathias Cannabis Practice Team. A great resource as we try to all understand this. I know there are a lot of moving parts. Thanks for your time, Tom. Always great to see you, sir. All right. Thanks. Well, throughout the pandemic, we have spent a lot of time here on the town hall looking at so-called long COVID. It's a condition in people in which they have symptoms and the effects of the disease for many months after they actually caught the virus. Well, now for the first time, it's been formally recognized by the World Health Organization. So they're calling it post-COVID-19 condition and defining it as symptoms showing up in people who had COVID at least 3 months later and lasting for 2 months, and with conditions that aren't linked to another diagnosis. Now, the symptoms here include fatigue, shortness of breath, cognitive dysfunction, loss of taste and smell, depression, joint pain. The list really goes on, and it can last for a very long time. The NIH here in the United States had a definition a few months back, and the World Health Organization says it took this long to define it for them because there are so many different symptoms. So today we asked Dr. Thomas Russo with the University at Buffalo about the impact of this definition.
Definition for long COVID is actually quite important. And it would be nice if we could get uniform definitions between NIH, the CDC, WHO, because we want to have definitions so that we can enroll patients in studies as the first step to truly understand how common this is, what is the spectrum of symptoms, and how long does it last. This is the first step in defining the clinical syndrome to move on with diagnostics and, most importantly, what everyone is desperately looking for, treatments.
Yeah, treatment's so important. The problem, Dr. Russo says, is that we just still don't know a whole lot about post-COVID syndrome.
Long COVID is a huge black box, which is going to be an enormous medical problem. It is right now, and it will become increasingly so. We're on the backside of this pandemic. It's affecting a significant proportion of individuals. Symptoms are lasting long periods of time. We're early on in this pandemic, and so we've been following people out for a year, and some individuals still have symptoms at this point. So this is something clearly we need to understand better. And of course, understanding what causes it is really the first step in trying to come up with some treatments, which people are desperately seeking out there. Having these symptoms really affects their quality of life.
So Dr. Russo says that there have been some indications that people who have long COVID symptoms can improve if they get vaccinated, but he says that really has to be studied more. Right now, there are no approved treatments for those long haul symptoms.